Hello, I'm Dr. Jeffrey Niezgoda. For the last several years, the American College of Hyperbaric Medicine and the Professional Wound Care Association has partnered in a collaborative effort with a very unique and special meeting. This meeting is called New Cardiovascular Horizons. And we are very honored today to have Dr. Craig Walker, the chairman of this meeting, here with us to discuss why you, as a wound care clinician, want to attend New Cardiovascular Horizons. Craig, good morning, and thank you for spending some time with us.
Thank you, Jeff. I appreciate the invitation.
So, New Cardiovascular Horizons has been in existence for quite a while. This is your 15th year anniversary, I understand.
It is.
Well, congratulations on that. You know, Craig, I have been honored to be a participant as a faculty for a number of those years, and I think this meeting is incredibly unique and very special, especially for someone who is practicing wound care, and you would not necessarily think that by seeing the title, and I wanted to talk to you about that today. Well, first of all, let's talk a little bit about why you created this meeting. What was your philosophy, and what were you trying to achieve?
Well, to start with, we have a worldwide epidemic of critical limb ischemia. And with that come ulcers and amputations and other issues. And in all of my travels and all of my lectures, I didn't see a conference which really addressed what I consider to be all of the elements of getting a patient well. This requires many things. It requires, first, the diagnosis and the referral of patients. It requires blood supply. It requires infection control. It requires diabetic control, smoking cessation, leg unloading, wound debridement, care of the wounds, new skins, all of the various things that make up what we call wound healing, and of course, hyperbarics. Now, there were a lot of meetings that would address one of these issues or two of these issues, but no meeting that I could find that addressed each. Yet, in my opinion, we have to address all of these because it is a chain and it's only as strong as its weakest link.
Well, I think those observations are right on target, and I can tell you as an attendee and a participant in the meeting, you really hit your target in that regard in covering this broad spectrum of topics. One of the aspects of the meeting that I find especially attractive from a wound care specialist is you have put together a world-class faculty of vascular interventionalists and vascular specialists that I learned from in a way that I can't describe to you, but I'm going to certainly try this morning. When we are interacting as a team in managing this patient, as you discussed, you know, everybody brings their skill set to the table. And these vascular specialists are incredibly important in treating our patients. As a wound care clinician, when I attend New Cardiovascular Horizons, I have an incredible experience in that I can actually interact with these world-renowned vascular specialists and really learn their language and learn their skill set, not certainly to practice it, but to understand it. And I can better communicate and advocate for my patient in regards to the clinical management. Is that one of your objectives, and have you received commentary from others that have attended the meeting that this is one of the elements that they take home?
We have. In fact, in today's world, so much more can be done to revascularize a leg than even just a few years ago. From my side as a vascular specialist, I sometimes see people who are followed for years and treated with hyperbarics and long-term antibiotics who never have assessment of blood flow. From my side of the field, I see guys that get blood flow but don't deal with the wounds. In my mind's eye, this is a terrible failure of our healthcare system. We have to do a better job of putting these things together.
Your comments are right on target. You know, as wound care specialists, we tend to hone in and focus on the wound, and I think we need to do a better job of assessing and diagnosing vascular issues and correcting those whenever possible. And I think that take-home message comes across very clearly at New Cardiovascular Horizons. Well, Craig, thank you so much for your time and commentary. For those wound care clinicians that are watching this presentation, again, I would strongly encourage you to look at registering and participating with us in New Orleans, May 28th through the 30th for New Cardiovascular Horizons. This year, New Cardiovascular Horizons will be offering wound care and hyperbaric certification sponsored by the American Board of Wound Healing. And I think that's an exciting opportunity for anyone involved in wound care to distinguish themselves by obtaining these certifications. And I'd like to thank you for your collaboration in allowing us to offer these examinations at your meeting as well.